Good evening and welcome to Tucker Carlson Tonight. For weeks, the media told you it was wrong to worry about the coronavirus, a mysterious, highly communicable, lethal disease spreading rapidly around the world. If that concerns you in any way, if you think maybe we ought to take some steps to protect ourselves from it, then you're a bigot. Coronavirus panic is racist profiling against Asians, lectured some arrogant moron at Slate.com. A writer for the Seattle Times warned that, quote, yellow peril racism was the real epidemic fear, and so on. Countless publications wagged their fingers in the face of readers and told them it was irrational, probably immoral, in fact, to worry more about the coronavirus than the annual flu. So fast forward to today. What began as a regional outbreak in the city of Wuhan, China, is now spreading across Europe. Parts of Italy are shut down tonight. Catholic services and, in some places, funerals have been suspended indefinitely. The shelves are bare. Panic shoppers buying in bulk as in a natural disaster, which this is, and it's moving fast. On Friday, the Centers for Disease Control warned that it is, quote, possible, even likely, that America will have a general coronavirus outbreak as well. That shouldn't surprise you. China is the world's most sophisticated authoritarian government. Its leaders have shut down entire cities, dragged people from their homes in an effort to curb coronavirus. But it hasn't worked. Officials in our country have reported about 36 cases of the virus in the U.S. so far. But that's a misleading number. The truth is we have no real idea how many Americans are infected. Why? Here's why. As of yesterday, only 3 public health labs in the entire country were properly equipped to detect the virus. Fewer than 500 people in America have even been tested for coronavirus, out of a population of 327 million. For real. Keep in mind that 5.5 million people ride the New York City subway every day. Worried yet? This could be serious. How likely is an epidemic in the United States? Are we ready for it if it comes? How many could die? So in any crisis, trust is critical, and not just for moral reasons, for practical reasons. The government can't coordinate a national response if the public doesn't believe what it says and doesn't believe the government's looking out for its best interests. That's why honesty is essential at times like this. When the government lies, people know. They can tell, and then they stop listening. From the beginning of the Chinese coronavirus epidemic, mask shortages have been a major problem. Some people hoarded hundreds or thousands of them. Manufacturers couldn't keep up. In some cases, apparently, they were sent overseas. The foreign countries we outsourced our factories to prudently decided to keep the masks for themselves. Nationalism is real in a crisis. And of course, here in the United States, our own government didn't have nearly enough masks stockpiled to cope with what has happened. Now, from the start, honesty would have been the right policy in the face of this. We could have just said to the public, we messed up, but healthcare professionals, the sick and the elderly need the masks most, so they get priority. And people would have understood that because it makes sense. But the government didn't do that. Instead, they told us lies, dumb lies, that anyone who thought about it for a second could see right through. They told the public, you shouldn't buy masks because masks don't work. On February 29th, the Surgeon General tweeted this, quote, seriously, people, stop buying masks. They are not effective in preventing the general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. The CDC amplified this untruth. Even now, the CDC's official coronavirus guidelines only recommend wearing masks for those who are sick or their caregivers. The press joined in, too. A CNN piece from March 2nd says this, quote, Americans don't need masks. The CDC says that healthy people in the U.S. should not wear them because they won't protect them from the novel coronavirus. In fact, face masks might actually increase your risk for infection if they aren't worn properly, but medical workers who treat patients with novel coronavirus do need them, unquote. Time magazine joined in to whine, quote, health experts are telling healthy people not to wear face masks for coronavirus, so why are so many doing it? What do you think, Time magazine, you moron? The article suggests that believing in masks is some kind of superstition, like not walking under ladders or being afraid of black cats. It's insulting. It's ridiculous. They're telling you masks don't work unless you work in a hospital? How does that work? Does mask effectiveness change based on what job you do? They're only useful if you're already sick? What? Coronavirus can spread from asymptomatic carriers. That doesn't make any sense whatsoever. Oh, wait, you're just too dumb to wear the mask. Okay, because they're really hard to put on. Of course masks work. Everyone knows that. Dozens of research papers have proved it. In South Korea, Japan, Hong Kong, the rest of Asia, where coronavirus has been kept under control, masks were key. So look, we understand there's a shortage of masks. We understand only certain people should get them because it's a triage moment. We get it. But stop lying to us because it makes us cynical. It divides the country. Tell the truth. We can handle it.
Well, that's a great question, and it's important for the American people to know that the task force always makes recommendations based on the science. And the science originally told us that people who wear masks are not protecting themselves from the virus. We actually recommend that people who have symptoms or people who think they may have a disease to wear a mask so they don't spread it to others. And the WHO, the CDC, and my office all initially stated that. What's changed? Well, what's changed is we found that there are a significant number of people who have asymptomatic spread of the virus. And so the CDC changed its recommendations today, and they now suggest that the general public consider wearing masks when they're going out in public so as not to spread disease to other people, particularly in situations where they may be closer than 6 feet from each other. A couple of really important points that I want you to know. Number one, this does not replace social distancing. The most important thing to do is still to stay home. If you're going to wear a facial covering, please make sure you don't touch your face and that you wash your hands so you aren't contaminating yourself. And leave the N95s and the surgical mask to the healthcare professionals because they need them to take care of high-risk patients. A cloth facial covering is what the CDC recommends. That works just fine to protect other people from you because we're all in this together. You wear a mask to protect me, and I wear it to protect you, Sean.